Temporomandibular joint dysfunction can be an abnormality with the normal function of the temporomandibular joint. The joint, as we know, is the joint involved during, like, when we chew or speak or talk, the jaw that moves during chewing. So the causes of temporomandibular disjunction are difficult to point out. Like, there can be no one single point or etiology which can cause a TM joint dysfunction. There can be multiple reasons. Like, sometimes it can be genetic or some jaw injury or malocclusion. So these can be multiple factors which can cause a TM joint dysfunction. The common symptoms of TM joint dysfunction would be, the most common would be pain over the area, at the area of the joint, which is located right in front of the ear. Other problems could be that patient could be having difficulty in chewing, reduced mouth opening, or painful clicking of the jaw. So these are the more common signs and symptoms associated with TM joint dysfunction. So how do we go about diagnosis is most important, that we see the patient in person and examine the person for the signs and symptoms of the disease, following which we advise further investigations like CT scan or MRI to diagnose the TM joint dysfunction problem. Coming to the treatment of TM joint dysfunction, depending on the severity and the type of TMJ problem, the treatment may vary from conservative or less aggressive to a more aggressive treatment therapy. Generally, most of the times we start with the conservative therapy, like use of painkillers, analgesics, medicines, or muscle relaxants, and we may follow it up or use supplemental therapies of using some appliances. Further, like, we can also do joint arthrocentesis, and the more chronic or more severe cases may require surgery.